Hey there, Dr. Luke here, and what I want to do is go through some variations of hip cars, a controlled articular rotation. First of all, what we want to do is go into the standing position. We want to hold onto a stick or a wall, and we want to breathe in and irradiate, increasing our intra-abdominal pressure. So we've got a really good base for our working joint, in this case, the hip, to work with. So we breathe in and irradiate. I'm contracting all the muscles of my body. And now I go into hip flexion. We're going right up to the top, exploring that outer range. We'll come to a roadblock here. We're trying to make the biggest circle possible. The roadblock, what we're going to have to do is go into internal rotation, exploring that outer range, extending back and through and around into this position. Then what we want to do is extend back. We want to create the biggest rotation possible, exploring that outer range. Come to a roadblock here. So now I need to externally rotate, extending right up into that flexion and back into that neutral position. So really slow and controlled in that pain-free range. Let's do that from this position. Breathing in and irradiate, flexing the hip right up, ducting, coming into internal rotation, extending back, creating the biggest rotation possible into that neutral position. Extending back, coming to that roadblock, externally rotating, and coming into that neutral position. So one more time, really think about making the biggest circle possible, exploring that outer range. Excellent. Externally rotating and coming back into that neutral position. Really slow and controlled. We don't want to go into any pain. With this one, no sharpness. And that's how you do a controlled articular rotation for that hip in that standing position. Okay, let's do a variation on all fours of our hip cars, a controlled articular rotation. So on all fours, breathe in and irradiate, flexing the hip up, coming around, internally rotating, and flexing down into that neutral position, extending, come to that roadblock, externally rotate, and come into that neutral position. So this is how it would be. So what we want to do is we want to create the biggest circle possible. So imagine exploring that outer range. In order for you to do that, you're going to have to externally rotate the hip and internally rotate the hip. You'll naturally want to do that. So as we come out here, we internally rotate, really exploring that outer and best possible range. So we really want to do this nice and slow and controlled in the pain-free range, and really try and explore that outer range. So that's how you do it on all fours with our hip cars. Hey there, Dr. Luke here. We're going to go through our hip cars in the sideline position, a controlled articular rotation. So I like to use a yoga block here just to rest my head on. And we're going to come down in the sideline position, arms out in front, legs nice and straight. And we want to breathe in and irradiate, contracting our whole body about 30% so that we've got a good base for our working joint. In this case, my hip, to work around. So we want to start here, irradiate, breathe in and irradiate. We want to flex the hip up as far as we can, searching for that greatest range. And now I'm going to abduct, and we're going to come to a roadblock here. So I need to internally rotate the hip here. So internally rotating the hip, extending back, and then coming back as far as we can. We out, moving the lumbar spine and coming back into that neutral position there. Now we're going to extend back, and this is when we're going to come to a roadblock here, so that we start externally rotating the hip, externally rotating, really explore for that outer range in that rotation, and then coming back into that neutral position. Let's do that once more. So we're going to flex the hip, breathe in and irradiate first of all, of course. Then we're going to flex the hip, coming up as far as we can. Then we duct, come to that roadblock. Now that we're internally rotating the hip, extending back, try not to move that lumbar spine, and back into that neutral position. Now we're going to extend back. We'll come to that roadblock. We need to externally rotate the hip, searching for the greatest rotation and range, flexing up and adducting, and coming back into that neutral position. So that's how you would do 2 reps of hip cars. It's really important that you move in your pain-free range. Any pinching or any sharpness in that hip, you pull away from, and then just explore the range that you can do in that pain-free range. So this is going to help maintain the movement that you already have, increase the movement as well, but also get all those sensors firing around that joint. Information to the brain allows you to coordinate movement and have greater control of that joint. So this is going to build the foundation of a good, healthy, functioning hip joint, and that's how you do a hip CARS.